Hello, everyone. Welcome to my YouTube channel, where I make pharmacology simple for everyone to understand. So today we would like to look at the subject of stroke treatment. I'm Professor Kennedy Edem Kukuya. So probably you've had a family member who has suffered stroke and survived, or a family member that unfortunately died as a result of stroke. I think that this subject is an important thing to look at, how it is treated, and if possible, how we could avert any of these situations in our own lives or in the lives of others. So let's get into it. Now, when we talk about stroke, what is it? So simply, it is referred to as a cerebrovascular accident. So imagine your brain. Since the time the brain was formed, the brain keeps functioning. It keeps working. Even when you are asleep, it is working. For the brain to be able to perform all of these functions, it needs constant supply of blood. That blood supplies it with nutrients, supplies it with oxygen. Now, when a time comes and that supply of blood doesn't get to the brain as it needs to, we may have the brain cells dying because you have restricted flow of oxygen to it. And so when that part of the brain or a portion of the brain dies because we don't have enough blood or oxygen being supplied to it, we say that the person has suffered stroke. Now, this reduction in blood supply could happen because a vessel has been blocked, or maybe there is a bleeding. And so we'll look at that. But what are the signs we can look out for when someone is suffering from a stroke? We use an acronym we call FAST. F represents the face drooping. So one part of the face may be drooping, or it's possible that you would see that if the person is unable to smile, if you ask the person to smile, the person may not be able to smile. You may also see that maybe one part of the lip is dropping in a way. You look at the A in the FAST, and that is arm weakness. If you ask the person to lift up the arms, the person may be unable to do that, or the person may not be able to do that for a very long time. 3, we look at S, which is the speech difficulties. So sometimes the speech is slurred or it is muffled, and they may be awake, but they may not be able to talk. That could happen. Then we have the T, which has to do with time to call. So because stroke can easily kill, it is important to ensure that if the person shows any of these signs, better to make a call for an ambulance to pick the person so that a prompt intervention can be put in place. These are not the only signs or symptoms people can exhibit when they are suffering from a stroke. Sometimes there could be confusion, there could be dizziness, there could be sudden feeling of unwellness. The person could have some headache because of the stroke. It's also possible that there could be a paralysis at one side of the body, or it could happen at both sides of the body. There is also the possibility that the patient may feel dizzy when a stroke happens. So quite a number of things may happen aside this acronym that we've talked about. Now, we look at the types of stroke. So depending on how the stroke occurred, we have two main categories. So if the stroke occurred because maybe there is a block in the blood vessel, okay, so in this image, you realize that there is a block. It could either happen by a clot, or it could happen as a result of a plaque, a fatty plaque, blocking the vessel. Now, if there is a block in the vessel and that restricts flow of blood, we will say that there is ischemia, okay? And so when the person's brain cells die as a result of maybe a disruption in flow of blood, either through the clot all the plaque, we'll say that the person has suffered an ischemic stroke. Now, if the stroke happened because of a bleed, hemorrhage, we will say that the person has hemorrhagic stroke. And so the hemorrhage may happen because maybe there is an aneurysm that has burst. Okay, so let's say that there is a portion of your blood vessels in the brain that had protruded in a way, we call it an aneurysm. But as a result of the pressure from the blood, if it happens that maybe that protrusion bursts, that bleeding could cause some death of particular portions of the brain, and that could also be considered a stroke. Okay, so when there is a bleeding, or maybe sometimes it may not be an aneurysm, it could be that the vessel, there is a tear in the vessel, and that tear leads to a bleeding that then causes the stroke. We'll say that the person has a hemorrhagic stroke. Then there are situations where people suffer from what we call a mini stroke or transient ischemic attack. These ones, usually the symptoms may resolve within about 24 hours or less. But even if the person's stroke is what you call a mini stroke and the symptoms resolve or the signs resolve within a short time, it is still necessary for the person to be taken to the hospital, because once someone has suffered a transient ischemic attack, there is a possibility that the person can have a major attack later. So the person still needs a medical intervention when the person is rushed to the hospital. Now, we come to how we treat the stroke. So first, we look at the treatment of ischemic stroke. It must be emphasized that depending on the type of stroke the person is suffering from, the intervention or the treatment may vary in a way. Because if you are not careful, you use the intervention for hemorrhagic stroke, for ischemic stroke, maybe it may not work well. If you use the intervention for ischemic stroke for hemorrhagic stroke, it may end up worsening the person's condition. And so it is important to know how we treat each of them. So treatment of ischemic stroke, since this one, the problem is the fact that there may be a clot or a plaque that is restricting blood flow, our intervention is focused on how to address that underlying challenge. So in treating ischemic stroke, we can use thrombolytics, which we also refer to as clot busters. We can use antiplatelets, anticoagulants, anti-cholesterol drugs, antihypertensive agents. Then there are certain procedures that we can do, thrombectomy, which involves trying to break down the clot. And then we also have carotid endarterectomy. So this involves a procedure where we cut through a portion of the neck and get into the carotid vessel. And then we try to break down the plaques that are formed in those vessels that are blocking the vessel. And then in thrombectomy, the procedure involves destroying or breaking down the clots through a surgical procedure. But let's get into the various drugs that we would use. So we come to the thrombolytics, the clot busters. Remember, we've said that in ischemic stroke, the problem is with the fact that either a clot or a plaque is blocking the vessel. And so one of the first things we normally want to do is that we want to lyse the clot. And in doing so, we can use tissue plasminogen activators, alteplase, and then tenecteplase are examples of drugs we may use. So how do they work? Let's imagine you have your clot, okay? So your fibrin clot. Now, when you give this tissue plasminogen activators, what they do, so we just write TPA. So this TPA binds to plasminogen and activates it. The activation then converts the plasminogen to plasmin. Plasmin then goes to break apart the clot. So plasmin would lyse the clot. And so the alteplase and tenecteplase, because they are tissue plasminogen activators, they are activating the conversion of plasminogen to plasmin that then lyses the clot for us. So if the clot is lysed, the vessel becomes open for blood flow to be restored to the brain. 2, we have the antiplatelets. Now, platelet aggregation may be one of the reasons why we have blood clotting. And so if we prevent the aggregation of the platelets, we can inhibit blood clotting. Even if you have dissolved the clot, there is a tendency that there could be new clots forming in the blood vessel. So it is important to ensure that after dissolving the clot, we prevent further formation of clot. And one way is to give antiplatelet agents. So we have agents like aspirin, which works by inhibiting the synthesis of thromboxane, which is one of the mediators that allow for platelets to aggregate, leading to clotting. We then have ADP antagonists like clopidogrel, ticagrelor. These ones, ADP is also another mediator that allows for platelet aggregation, leading to clot. So by blocking the receptor of the ADP, we can prevent the clotting. Then we have dipyridamole and then cilostazol. These two are agents that block phosphodiesterase. Normally, when you block phosphodiesterase, that will lead to the accumulation of cyclic AMP or cyclic GMP. And these have been shown to inhibit platelets from aggregating and then clotting happening. So by inhibiting the phosphodiesterase, we can inhibit platelet aggregation, and then we don't have the clot. So these drugs are very crucial. Then we come to anticoagulants. So just like the antiplatelets, we could use anticoagulants to inhibit the tendency for the blood to clot easily. And so heparin can be used. We can have the high molecular weight heparin or the low molecular weight heparin. Any of them could be used, but these are used for a short time. Then the rest of the drugs like warfarin, apixaban, rivaroxaban, edoxaban, dabigatran, those ones can be used over a long term. The next class of drugs, anti-cholesterol. Remember, we've said that in ischemic stroke, there could be plaque formed in the vessel that restricts blood flow. So because this plaque comes from fatty substances, we can reduce the synthesis of cholesterol in the body, and that can help in reducing further formation of the clot of the plaque. So statins are one of the agents or groups of agents we can use for that. So we have examples like rosuvastatin, atorvastatin, simvastatin. These drugs work by acting on an enzyme we call HMG CoA reductase. So they inhibit the HMG CoA reductase, which is necessary for synthesizing an intermediate leading to the production of cholesterol. So by inhibiting the enzyme, that important intermediate that leads to the synthesis of the cholesterol its synthesis will reduce, and that ensures that cholesterol synthesis goes down. Now, as the cholesterol synthesis goes down, there is an increase in the expression of receptors on the liver that mop up low-density lipoprotein, what we call the bad cholesterol. The drugs make sure that we mop these up from the blood vessel. So that helps a lot. Then we come to antihypertensive medications. Now, the chances are that people may suffer stroke because of the fact that they are hypertensive. And there are various drugs we could use in ensuring that we bring down the blood pressure. We have the thiazides, such as bendroflumethiazide, indapamide. Indapamide is a thiazide-like diuretic. We have the ACE inhibitors, very important drugs. We have enalapril, ramipril, lisinopril. We also have the angiotensin receptor blockers, candesartan, irbesartan, valsartan. These are agents that could also be used. We have the calcium channel blockers, amlodipine, nifedipine, felodipine, verapamil, diltiazem. Then beta blockers such as atenolol, bisoprolol, labetalol could be used. And lastly, alpha blockers, we have doxazosin and then prazosin. Any of these drugs have been shown to be very useful in dealing with the reduction of elevated blood pressure in patients who have suffered from stroke. Then now we come to treatment of hemorrhagic stroke. So as we know, we said that in hemorrhagic stroke, the stroke has happened because of a bleed. Okay, there is a bleeding. Now, depending on where the bleeding is, there are certain interventions we can make. But let's get into what we do. So the pharmacological management, we have antihypertensives because one of the major reasons why people have hemorrhagic stroke is because of hypertension. And there we could use labetalol, which is a beta blocker. We could use nicardipine, which is a very important calcium channel blocker that has some selectivity for the blood vessels in the brain. Then if it is intracerebral bleeding, because with the intracerebral bleeding, we could have increased intracranial pressure that could further damage the blood, the brain. We could use osmotic diuretics like mannitol. But if there is an active intracranial bleeding, please do not use mannitol. You may end up worsening the situation. Then the patient may sometimes have headache, especially if the bleed is within the meninges. There could be some headache, and there could also be an elevation in body temperature. So we can use antipyretics and analgesics. Mainly paracetamol would help. Please ensure that you don't use NSAIDs. NSAIDs such as aspirin, diclofenac, and the rest may worsen the situation because you are going to reduce the tendency for blood to clot. Since there is already bleeding, using those other drugs may enhance bleeding further, and that could worsen the person's situation. Now, because of the bleed and the death in the portions of the brain, sometimes there's a tendency for seizures. So there may be a need to institute therapy to either prevent the seizures or to address these seizures. Levetiracetam has been found to be one of the important drugs that we could use. Phenytoin or fosphenytoin. Fosphenytoin is a prodrug of phenytoin. You administer it, it is converted to phenytoin, and it can work. And usually we like to administer these drugs intravenously. We also, aside these anticonvulsants, we could add diazepam to them. It has been shown to also have anticonvulsant effect, and that helps a lot. Then because the person is bleeding, sometimes the bleeding may occur because the person was on certain medications that we will consider as anticoagulants. So we may need to block the effect of those medications. So we could give vitamin K, we could give protamine. Vitamin K tends to inhibit the action of warfarin, and then protamine inhibits the action of heparin. So if the patient has been on some of these medications, by giving vitamin K or protamine, we can find a way of stopping the bleeding. Then it has been shown that people may have gastric ulcers as they go through the hemorrhagic stroke. The reasons are not very clear, but this is one of the things that could happen. So we may want to prevent the gastric ulcer or deal with the gastric ulcer. So we use a histamine H2 receptor blocker, an example being famotidine. Now, aside this, sometimes there could be surgery that we put in place to repair the tear that has happened. Now, let me add that it is better to prevent the stroke than to treat it. So, lifestyle modifications, making sure that you eat well, making sure that we reduce alcohol intake, we stop smoking. These are things that we can put in place to ensure that we live a healthy life and do not have complications of various conditions that could have led to stroke. I'd like to say a big thank you for making time to watch this video. Once again, this is Professor Kennedy Edem Kukia, and it's a bye for now.